Hi, I'm Asha Vahabzadeh at CES 2019 at the Digital Health Summit studio, and I am here with physician scientist Daniel Kraft, who's also the founder and chairman of an extraordinary conference called Exponential Medicine. Wonderful to have you here, Dr. Kraft.
Great to be back at CES.
So you're really a pioneer in terms of understanding and really looking at digital technology. We've just had a whole decade of these technologies, and we're looking forward to another decade. What do you see as some of the most interesting and practical technologies going forward?
Yeah, so we had a session that I led on, the past 10 years and where we're heading in digital health. And I think, looking around CES and the thematics we see today, the first few years were like, the little widgets. The next few years have been starting to connect the dots. And where we're going is going from, pieces of quantified self to quantified health, where the data from your connected blood pressure cuff, which I just got on my wristwatch, to your Fitbit and your sleep data, to your genomics, are becoming integrated in a meaningful, actionable way that you as an individual can hopefully make sense of, as well as your clinician and health system. We're still at the early days of that, but it's putting the pieces together and tying that to reimbursement and incentives.
And there's some progress in terms of looking at artificial intelligence, algorithms, machine learning. There's also a lot of hype in that area. What is your take on what's happening in terms of healthcare, medicine, and what will happen there?
Well, we're in this exponential age. I run this conference on exponential medicine. No clinician can keep track of your step data and sleep data, let alone your omics and Internet of Things information. And we need AI, or I like to call it IA, intelligence augmentation, to start making sense of that, integrating into the workflow of the individual, the caregiver. And AI does have some hype around it, but it's going to be necessary to leverage these new data sets so they go from data to actionable information, and that we start to crowdsource that and make that useful so we're doing real-time intelligent healthcare. So if I'm seeing you in the clinic and you have a certain condition, I'm not just looking at some 10-year-old double-blind placebo-controlled trial. I'm looking at other psychiatrists from Boston who have a newborn at home, who have genomics like you, and I can hopefully make a very informed, guided choice.
And genomics itself, we've heard a lot about CRISPR technologies and DNA analysis. Where's genomics going?
It's going beyond the genome. I mean, we're now literally at I've had my genome sequenced like 3 or 4 times. It's now below $1,000. At CES 2025, it should be $100 or even free. Some companies are offering a free genome if you share your data, so to become a data donor. And there's still some low-hanging fruit, your pharmacogenomics, how your genes impact which drugs and doses you might take, like a statin or a blood pressure medicine. The trick is getting clinicians like ourselves to actually see that information in a useful way so that at the point of care, prescription, we can use that genomic information. It's not just a heredity kind of, 23andMe, are you part Neanderthal or part Asian?
When are we going to see an AI doc?
Well, in a sense, there are AI docs. In the mental health space, in the primary care side, a lot of it can be algorithmically based, and there's some chatbots already out there that can do a pretty good job. Part of the future of clinical care will be talking to the AI chatbot first. It's going to learn you. It's going to know your digital exhaust and when you're
triage, like a triaging service, perhaps.
Right. It may hopefully give you early warning if your wearable device, of which I have too many on today, sees that your resting heart rate's gone from 56 to 76 over a week or two. Something's going on with your cardiovascular system. Your voice can be a biomarker for your health.
There's a huge interest there.
The way you type on your smartphone, all those things can be markers that we just had Jessica Mega, the Chief Medical Officer from Verily, as we look at understanding your baseline or my baseline, there's a big opportunity. The challenge is, how do we get these technologies into the hand of patients, doctors, consumers? I sort of soft launched today a new website, digital.health, to be sort of a home for all things digital.health, not for the consumer, but for clinicians, digital health researchers, to start to understand what's available. If you've got AFib, you want to know about AliveCore. It's already on the market. If you've got hypertension, maybe you want to get the new Omron watch, and hopefully integrate that data into the EMR and share it with others so we improve knowledge along the way.
So what was that website?
Digital.health.
So it's a hub for information, all the cutting edge information it will be.
It's a platform for digital.health, both for the ability to find something you might want to prescribe to a patient, to understand the regulatory route, which is changing. One of the things that's happening in the last couple of years is the FDA is getting up to speed on software as a medical device, pre-check platforms, ways to accelerate software as a medical device and this digital era into approved, digiceuticals and beyond.
Well, thank you very much, Dr. Kraft. You always have your finger on the digital pulse, as it were.
And most of the pulse, if you want to come to exponentialmedicine.com, our website, and our actual conference where you've been on faculty, exponentialmedicine.com, November 4th through 7th, is a great place to see where all these things are converging from the digital side to the genomic side to AI to blockchain and beyond.
Wonderful. Well, thank you very much.
Thanks.
This is Arshad Wahabzadeh at CES 2019 at the Digital Health Summit Studio, sponsored by Living in Digital Times, and I was joined by Dr. Daniel Kraft, Chair and Founder of Exponential Medicine.